Hello and welcome to Mississippi Insight. I'm Byron Brown. Thank you for joining us. This week, why did a top business research firm rank Mississippi the nation's fourth worst state for entrepreneurs? We'll hear from one of their experts this hour. Also, the state's Agriculture and Commerce Secretary speaks out against COVID vaccination mandates. Andy Gipson says he doesn't need one himself. We'll do a fact check. And could tests of municipal wastewater help health officials track the virus and curb severe outbreaks? We'll talk with a scientist with the CDC this morning on Mississippi Insight. Given the cheerleading by state officials in recent years, you might think the Magnolia State is a fantastic place to start a new business. That may be the case for many entrepreneurs, but a recent report by the research firm Advisor Smith paints a far different picture. Joining us via Zoom is Brenda Franco. She's with Advisor Smith, a leading research firm and information resource for small business owners across America. Brenda Franco, welcome to Mississippi Insight.
Hi, Byron. Thank you.
Well, what was the purpose of this latest report, and where does Mississippi rank among the 50 states?
Yes. So here at Advisor Smith, we focus on content for small businesses. So we publish all kinds of research on trends in the economy and trends around small business to help small business owners really understand, what are the things that can help them be successful. There are a lot of different aspects to running a small business, from everything from choosing what kind of business you want to, thinking of demographics or trends of the places where the economy is booming or busting. So we really try to look at everything under the sun that we can help small businesses. Whereas, many small business owners know that there's a lot of blood, sweat, and tears to running and making a business successful. So we really try to provide as much information and a variety of information that can help small businesses or entrepreneurs succeed in their business.
Why does Mississippi rank so low in this report?
Yeah, so for this specific study, when we were examining all 50 states, we looked at 20 indicators of the health of the small business environment across states in the nation. So we utilized data from the U.S. Bureau of Labor Statistics and the Small Business Administration. For each state, we looked at different elements to create an aggregated score. So we looked at corporate tax policies, rates of business formation and hiring for new businesses, funding availability, and business survival rates. If we're looking at Mississippi, from the data that we concurred, we found out that in Mississippi, there are 77 new businesses created and 331 new entrepreneurs per 100,000 residents. The value of new business loans per business in Mississippi is $7,170. And looking at the 4-year business survival rate in Mississippi, it's 55%.
Is it clear from your research why businesses have such a relatively low rate of survival?
What I can tell you is that the states in the bottom 10 that suffered were there because they suffered from low business survival rates, low business lending rates, and a low number of entrepreneurs and low business formation. Whereas if you look at, let's say, the top 10 states, several states had very unfavorable tax environments. However, they ended up being in the top 10 because they have high rates of entrepreneurship and high rates of business survival.
Business lending is a big factor in your rankings. Why is that such a barrier for entrepreneurs in Mississippi?
Yeah, that's a good question. In order to start a business or anything you want in life, you need to have capital and money in order to do so. So in order for entrepreneurs or small businesses to be able to get a loan and to be able to receive a pretty good amount of money, it's definitely works in their favor of, being successful and being able to have the funds to start their business or grow their business in either like marketing or anything else. So it's definitely resources for them to succeed.
Talk to us about the best states for small businesses and what are they doing right?
Yeah, so the best state in the country for small businesses was Idaho.
And what's Idaho doing right?
So Idaho, in comparison to Mississippi, they have a business loan that's much higher. They actually get $9,000 and their business survival rate after 4 years is 58%. So it's already 8% higher than Mississippi.
All right. Are there policies that your firm believes would help small business creators not only start up, but keep going?
That is a good question. I would say factors that could help small businesses and entrepreneurs succeed in any state would be able for them to have the ability to, receive a loan. Also, the price in starting a business, a lot of people don't know that in order to create any business, you have to pay a fee to the state. So being able to have reasonable prices for people to pay that.
What advice would you give to someone who's watching who wanted to start a small business in Mississippi where there are some challenges here?
If somebody were to want to start a business in Mississippi, they should do their research and kind of figure out, the area where they want to set up their small business, kind of seeing like if the city they were interested in is a good area for whatever kind of business they're putting up. If there's a lot of like traffic and movement, the cost to rent an apartment or own a home in that area would also be good. Seeing if it's a safe area, wanting to feel comfortable in their own home while also not having to worry about that while they're running their business are all factors that people can take into consideration if they want to start a business in Mississippi.
Brenda Franco, appreciate your time and for joining us.
Thanks so much, Byron.
All right. Congressman Bennie Thompson says the Build Back Better Act will save Mississippians thousands of dollars in child care costs annually. The Mississippi Democrat cites an analysis from a House panel on the bill. It would spend up to $3.5 trillion on a host of social programs. Well, Thompson was at the South Delta Vocational Complex in Rolling Fork for an event. He spoke with reporters Thursday about the $1.2 trillion transportation and infrastructure bill. The U.S. House is still wrangling over the details on that one. Thompson says he expects a vote on the measure by the end of October. Here's a congressman speaking with Mississippi journalists about that bill and more.
Well, obviously, we're working on transportation and infrastructure package. We expect to vote on it, hopefully by the end of October. We also look forward to the January 6th committee that I chair. We're having subpoenas issued for various people around the country who participated in the insurrection on January 6th. We'll get to the bottom of what happened, but also we need to. It was a sad day for our country, and we need to make sure that it never happens again. So in order to do that, we will be working diligently night and day to get the information.
Anything happening, any bills on the floor that can impact our state, anything?
Well, we're doing appropriations bills all over. There's the issue of flooding here in the South Delta that comes up quite often. There's a group who's trying to come together with Commissioner Willie Simmons to finish Highway 61. The last part of Highway 61 that's not connected is the Vicksburg to Leland portion, and so part of the funding for that is in the transportation and infrastructure package. Our ports in Greenville, as well as Vicksburg and Rosedale, there's money for those facilities also to be upgraded in the transportation infrastructure package. So it's to our advantage that the Mississippi delegation supports it. I hope they do. On the Senate side, Senator Wicker has already said he will support it and his vote demonstrated. But in order for it to pass, we need a majority vote in the Senate and a majority vote in the House of Representatives. And if it passes, that means jobs and opportunity. It means broadband opportunities for the kids who attend South Delta High School. So there are a lot of things that are directly related to transportation that are so important to the progress of not just this school district, but Mississippi as a whole. All these programs are what you call discretionary. City of Jackson has to make application. We can't run a city or a county. Those municipalities or those counties or political jurisdictions have to step up, make application, complete the documentation that's required if they want federal help.
So they haven't done any application?
I have not seen any. The only thing I've seen is people saying we need federal help. I've not seen any streets listed. I've not seen any of the documentation that's required.
We've asked the 2nd District Congressman to appear on Mississippi Insight as soon as his schedule allows. If you have questions for Bennie Thompson, email them to us. The address is news@WJTV.com. Up next, Commissioner Andy Gipson and why he has not gotten a COVID-19 shot. Does he have a point? It's Mississippi Insight only on 12 News. And welcome back. Mississippi leadership remains split on the topic of COVID-19 vaccinations and whether they should be mandated or not. A lot of the pushback stems from President Joe Biden's order mandating vaccinations for federal workers and for companies with 100 or more employees. Governor Tate Reeves has strongly criticized those mandates, and so has Agriculture and Commerce Secretary Andy Gipson. Saturday, the Republican from Simpson County was set to speak to a group called Mississippi Patriots for Vaccine Rights and Medical Freedom. Now, they organized a rally in downtown Jackson to protest the federal mandates. 12 News' Town Talk caught up with Commissioner Gipson earlier in the week and asked for his thoughts on the matter.
You know, I just believe in freedom, and I don't like what I see happening in America with all the mandates that are coming down from Washington and now being imposed on private businesses, and I'm going to be talking about that. I think Mississippians, if people want to get the vaccine, I want them to have the vaccine. My mother took the vaccine, and I encourage that, but it's a personal decision between them and their doctor. And I'm a good example, and I'll be talking about this Saturday, of a person who is not in a medical position to take the vaccine. So I think medical freedom is something people need to realize that we've got to speak up on, and certainly support getting the vaccine if people want it and need it, and support all those efforts. But at the same time, we've got to balance that with the freedom that we have. And up until this point, people's health care information has been private and personal, and I'm concerned about that eroding, and I'll be talking about that Saturday.
Are you vaccinated, Commissioner?
You know, I am not. I actually have got natural immunity due to having had this virus earlier, and so I don't have that vaccine, but that's another subject we need to talk about. You know, people are requiring cards for a vaccine, but some people actually have the antibodies in their bodies, so it's something that we need to consider.
Well, the Centers for Disease Control and Prevention report Mississippi remains one of the least vaccinated states in the nation. At last report, less than 45% of our 2.9 million people were fully vaccinated. The CDC says even if you've been infected and recovered, you can still be reinfected, and vaccinations remain the best defense against infection. We did ask for comment from the state health department. They declined. After the break, tracking COVID-19 in wastewater. It could be a huge resource for fighting outbreaks. And we'll be right back. You're watching Mississippi Inside, and we're going to talk about a new method under development for tracking a virus that has already killed almost 10,000 Mississippians since January of 2020. This is groundbreaking work by federal scientists. And we're joined now by one of those scientists right now. Dr. Amy Kirby is a microbiologist with the U.S. Centers for Disease Control and Prevention, and she is the program lead for the National Wastewater Surveillance System. Dr. Kirby, welcome to Mississippi Insight.
Thank you. It's my pleasure to be here.
Dr. Kirby, explain to us how testing wastewater might predict trends in cases, and is it quicker than clinical testing?
Yeah, so wastewater surveillance is really a great tool that we have available in our public health arsenal. The National Wastewater Surveillance System, which we call NEWS, was established in 2020 by CDC to provide community level information on the COVID-19 pandemic. And there's really 4 reasons that wastewater surveillance is a really important tool. So first, it captures all of the types of infections that happen in a community. So we know that people will shed the virus that causes COVID in their stool, whether they have symptoms or not. And adults and children do that, will shed virus in their stool. So we can see all of the types of infection in the community by looking in wastewater. Second, it's not connected to medical care. So it doesn't matter if people go to the doctor or if they have access to clinical testing. As long as they're using a restroom that's connected to a sewer system, we can get that information through wastewater surveillance. Third, it's very efficient. So just by taking that one sample coming into a wastewater treatment plant, we can get information on hundreds, thousands, even millions of people in the largest wastewater treatment systems. And finally, as you alluded to, it's fast. Between the time that the toilet is flushed and when we can have data in hand on what's in that wastewater, it's about 5 to 7 days. And what we see is that on average, we see trends in wastewater about 4 to 6 days earlier than we see those same trends reflected in case reporting from that community.
All right. Dr. Kirby, why is it important for city and state health officials and the people they serve?
So what we hear routinely from the health officials that are using wastewater surveillance is that it gives them confidence that they know what's going on in their community. So as you can imagine, our health department officials have a lot of data coming at them, and it's not always going to agree. And so sometimes they're trying to make decisions based on conflicting data. And as I said, wastewater surveillance is not connected to clinical care, unlike all of our other surveillance systems. And so that makes it uniquely valuable in that satellite suite of surveillance data that's available. And so it helps them know when cases are really increasing in a community, when they're really decreasing, and so that they can allocate their resources effectively. And we've seen them use that information to make decisions about siting of mobile testing units or vaccine clinics, or how to deploy contact tracing teams.
How long has the CDC been utilizing wastewater surveillance, and has it proven effective in curbing outbreaks and other case studies?
Yes, wastewater surveillance is not new. We've been using it for polio tracking in global settings for many decades, and it's been used very successfully to work towards eradication of polio. News for COVID is the first large-scale use of wastewater surveillance in the U.S. So the system was established in September of 2020 as part of our COVID-19 response. But we really see this as part of the surveillance portfolio for CDC for the long term. So the program is funded through 2025, and we intend to continue funding it past then. And really, we want this to be, part of the surveillance toolbox that we can use to understand diseases beyond just COVID. So things like antibiotic resistance, foodborne infections like E. coli and Salmonella and norovirus, as well as emerging infections like the fungal infection Candida auris.
How can institutions like nursing homes, colleges, and universities, even prison systems use this technique to manage COVID-19?
Yeah, so our primary focus with news is community surveillance. So taking that wastewater sample at the wastewater treatment plant, which gives us information about the whole community that's served by that treatment plant. But you can also take the same approach at the facility level. So looking at the wastewater that's coming out of a single building or a single facility. And where we have seen that used most effectively so far is at universities, where they've used wastewater surveillance to detect outbreaks in dormitories when it's only 1 or 2 or 3 cases, so that they can then go in and with additional mitigation efforts to control those outbreaks. We are now trying to replicate that success in settings like correctional facilities and nursing homes, where we're hoping that we can use wastewater surveillance and rapid testing to enable them to control COVID-19 outbreaks in those settings as well.
Can people, especially local and state officials, go online to learn more about this program?
We do have a website. So if you Google NWSS News and CDC, it will take you right to our website, where we have lots of information about wastewater surveillance. And in the next couple of months, we expect to roll out the news data onto COVID data tracker. So people will be able to go in and see data from their communities and communities around them in near real time on data tracker. So that should be happening in the next couple of months as well.
Long term, how do you expect this to help us to deal with the COVID crisis that we're facing now?
Yeah, again, I think where we find it really useful is that our health departments tell us that it gives them confidence that they know what's going on and that they can make good decisions about how to allocate limited resources like clinical testing capacity. And so when we're in places like we are right now where cases are high, those sorts of decisions are really critical because we need to make the best use of our resources that we can. When cases start going down and we're in an area where, or a time when we're doing better and have fewer cases, wastewater surveillance is going to be really important to detect any reemergence of COVID in a community as early as we possibly can. So it's important to keep wastewater surveillance going, even when we think there are no cases in the community, because it could be that first sign that the infection is reemerging in that community.
All right, Dr. Kirby, thank you for your time and for information.
Absolutely, it was nice to talk to you.
All right, thank you very much. And we'll be right back. Our thanks to Brenda Franco from Advisor Smith, Dr. Amy Kirby from the CDC, and 12 News' Tal Ta for their contributions this week. We'll be back next Sunday morning with more of the political and current affairs coverage that you demand. I'm Byron Brown. From all of us here at 12 News, make it a great weekend.